Hello and welcome to Healthcare IT Today. I'm Colin Hung, and today I'm about to sit down with Dr. Nallapaneni, and we're about to talk about how he has to be so resourceful given where he works for an FQHC. Dr. Nallapaneni, welcome to the program.
Thank you for having me, Colin.
Yeah, it's really great to have you. I'm excited to sit down with you because I love talking to FQHCs because you have to be so resourceful, so careful with your resources,
Yes, sir.
and I'm excited to dive into that with you. But before we get there, maybe can you tell me a little bit more about your organization, CareSTL?
Yeah. So CareSTL Health is almost 60 years in existence, and the roots of the organization is in civil rights movement.
Okay.
So, and then obviously as part of the civil rights movement, there's also immediate recognition of the importance of recognizing the healthcare disparities and the social determinants of health.
Okay.
So that's how the organization has started, and ever since in existence and in initial conception, we have always had been in the forefront in the especially North St. Louis region to do the best we can to try to help the most needy patients who are underserved, who has no insurance, and unfortunately also sometimes end up being very sick. So the mission of the organization is take care of the poor and sick people, and regardless their ability to pay, regardless of their insurance. And that's one of the things you also see where the patients who we serve see us as part of the community. We are located literally embedded in the community, and in the recent survey that they did on the patient satisfaction, we got 95%. And this is not by us, it is by healthcare plans who did a survey independent of us. That is the origin of the organization. And our current CEO, Ms. Angela Claiborne, who hired me as the Chief Medical Officer, she has this grand vision to make sure we build a health center that is the best in the state of Missouri. And when she hired me, she gave me the task. And so she is my mentor and truly a great inspiration for me for all the work we do at CareSTL Health. And she told me to basically go ahead and bring the best change. That's how we are in existence, and that's what we are doing as a work today.
What kind of services do you provide to those patients in your communities?
So we provide all the primary care services HRSA designates for FQHCs to serve. So we provide adult medicine, we provide pediatrics, we provide women's health, and including labor and deliveries, and we also provide podiatric services and behavioral health services. We also provide optometry services and chiropractic services. And and then we are also always looking to see how to expand, and we are recently in the process of trying to build a new health center, and in this new health center we are also trying to have a wellness campus because we want to provide a comprehensive healthcare delivery, not just only medications, lab tests, but also health program, diet, nutrition, exercise as part of the healthcare delivery.
As an FQHC, and especially one based in St. Louis, you're at the forefront of the challenge of access to care.
Yes, sir. Very much so.
So how have you addressed or tried to address this problem? What are some of the things that you're doing to improve access in your region?
Sure. It's a very good question. So obviously the important thing in healthcare, no matter where you are in the world, is being accessible to healthcare. Because even if you have a good plan to deliver the healthcare, if you're not accessible, then you're not going to be able to deliver anything. So one of the things what we have done is we have been in the community. We built our health centers. We had a recent new health center also. We expanded into the North County. So pretty much what we did is we created our locations and put them in the place where the people are. And one of the things as FQHC we are required to do is we are required to submit yearly data called UDS data. In the UDS data, it tells us where the patients are coming from. So we found out 1/3 of our patients are coming from the North County. So then what we did is we opened a location in North County. So that's one way of actually physically giving increased access to the patients. And the other way, what you can also do is, navigating the healthcare infrastructure is also not that easy. So one of the things we have been doing for some years now is same-day walk-in patients. So typically, generally what you do in a healthcare is, you have a scheduling system, you have an appointment system, you go there. But let's say, for example, you have a problem right now. You have a rash that is bothering you now, or it could be even something more significant. So we had created and built into the template something called walk-in appointments or same-day appointments. So each provider would have something on average anywhere between 6 to 8. Mm-hmm. So nobody would be turned away if they actually call in or actually come into the health center.
And you said there a template. This was done in your EHR that
yes,
you
sir. In the electronic health records, you can actually design the template to having a slots based on the specialty. And one other specialty we also do a lot, I forgot to mention, is psychiatric services.
Okay.
In addition to the behavioral health services, behavioral health is, very closely linked to, but, psychiatric MD service also we have. So the reason I brought that up is their templates are different. Mm-hmm. A psychiatrist usually has a much longer time than a regular primary care, like in a adult medicine or even pediatrics. So in the template, when you're building in, you can actually leave some slots open for walk-in slots. And so we also look back at the no-show rate and also how much need is there, how much demand is there. And we have triage areas where they come in immediately, and based on what their complaint is, would be rerouted to a respective department. If it's a kid who needs a pediatrician, immediately go to the pediatrics. And then if it's adult medicine, it goes to the adult medicine doctor.
As an FQHC, you deal with sort of lots of different types of patients, lots of different acuities of patients, mm-hmm. and it sounds like you're using your system to make sure you're rerouting people to the right place. You have to be very adaptable.
Yes, sir.
The platform, you're on eClinicalWorks.
Yes, sir, we do.
How have you morphed or how have you adapted the program mm-hmm. to adapt with you?
Sure. So when I first became the Chief Medical Officer and under the guidance that my CEO, Ms. Angela Claiborne, gave me, is to bring the best change, as I was telling you earlier. And so to provide the best healthcare, what you need is you need the tools, technology, and the skills. Mm-hmm. And then the skills is what the providers, doctors, nurse practitioners, they bring to the table. And technology is also very important. So we had upgraded all our radiology equipment. We now have a hologic 3D mammography. We have a brand new X-ray department, and we also have brand new ultrasound. And also we updated all the lab equipment. We have a brand new CBC machine called Sysmex, and we have a Alinity, which does both the immunochemistry, and also we also have the Fenian point of care A1Cs. And in the pharmacy, we also bought robotic arms so that it can do automatic filling, so that we can do faster prescriptions, quicker. And the other thing, in addition to the technology, I said, is the tools. And the most important tool in healthcare is electronic health records. So that's when my boss gave me the guidance and shared with me that in the past, before I came on board, they had a conversation with the eClinicalWorks. And of course, COVID hit and things like that. So she pointed me in the right direction. And from then onwards, I was in touch with the eClinicalWorks. And then after that, we adopted eClinicalWorks as our electronic health records. And eClinicalWorks has a lot in built-in user-friendly tools that we use, mm-hmm. Whether it is what we call a chronic care module, or whether it is scheduling system we just mentioned. And I just attended the conference, and I'm so excited to see that there is even this new AI-enabled tool where it can actually not only tell you what the no-show rate is, but also predict where the no-show rate is going to be. So as you already mentioned, the first thing you mentioned was the resourcefulness of FQHCs. And the federally qualified centers, as you have said, is always short on resources, and maximizing the resources is very important. So no-show rate does significant impact, not only the revenue cycle, but also the workflows.
Right.
So let's say, for example, you have 3 patients showing up in one time versus nobody showing up in the afternoon. So then we're not utilizing evenly. So they might get burnt out in the morning, and then in the afternoon maybe not have any patients. So with this new Helio app that we're trying to do, we can stay in contact with the patients,
Right.
and then also we can even probably see when best to and identify the high-risk patients or moderate risk and low-risk patient with a no-show rate. And then we can probably try to reach out to them more or use an extra means to,
to bring them back in.
make it easy for them to access the healthcare.
Yeah, like that was a pretty exciting feature that they introduced where they were talking about, I guess, basically stratifying the risk of patients who might not show up.
May not show up, yes.
And then the ones who are most at risk, you can apply additional means to try and encourage them to come in. More, maybe a phone call or two, an extra text message or something.
Yes, sir.
And we heard from one organization who was even adding a link to allow them to reschedule because maybe they just can't come.
Correct.
But that allows you to fill that slot with someone else, right? Or at least plan around it to make better use of your resources.
Right. Also give that data to the outreach department. So, outreach departments go and knocks the doors. Then they have a high yield, high impact of where is that they need to go, rather than using the data that is not high risk stratified versus high risk stratified data. You can go after the high risk stratified and say that will make a true difference. And as you already mentioned, patients are also sometimes in a difficulty probably not being able to access the health center. Sometimes it could be as simple as transportation.
Exactly.
So this is where the outreach department can reach out to them and give them transportation vouchers or various different other means to be able to help them. And even the other thing we are constantly talking about is the mobile access, mobile clinics. Clinic on the wheels, and our dental department is still doing something. And I forgot to mention one of the big major division we also have is dental services, and we also have the very big dental department as well.
Right. So with the power of the data that you're collecting, with now the power of AI, you can better meet the patients where they are, whether that's through mobile or whether it's rescheduling or, like you said, with a transportation voucher, because maybe that was the reason why they haven't responded or not able to come in.
That's correct.
So,
I mean, most of the time what we truly see that's impacting the patient's healthcare is that their inability to access the healthcare. And I'm so glad you had brought that as a first question, is that is so important, especially in a federally qualified health center. And there's a lot of data that shows that, with not having good access to healthcare, your quality metrics, your blood pressure, sugars, all will be not at the right parameter where it should be. So this data will help us to not only identify that the high-risk patients, also where they are. So for example, if there is a data analysis that showed that in this particular zip code, these patients are having difficulty to access, we probably should do something different to reach out to that patients, or maybe arrange a transportation system for the patients. So we can always come with new innovative ways of trying to meet the needs and demands of the patients.
I want to ask you this question because FQHCs have been on the front line of social determinants of health, even before it was called social determinants of health.
Yes, sir.
And so when we look at that term now, it's very large, it's very nebulous, and it's a massive problem. As an FQHC, as a practicing, having practiced in this world for a little bit, where would you recommend that someone start with SDOH? How could they, where is a place where they can actually make a meaningful difference?
Sure.
With that?
That's a very good question. It's a huge passion of mine too. One of the important thing is the crux of the healthcare delivery is always in the doctor-patient relationship. And earning the trust of the patient, being honest with them, and explaining to them in plain, simple terms. And of course, with various past experiences the patient had, there is a reason why they're hesitant. And so if we actually earn the trust of the patient, and by being open, transparent, and most importantly, giving them the control. And one of the things I do is, for all my patients who I see for the very first time, I have a PowerPoint presentation for them. And in that, the two foundation pillars of healthcare delivery is evidence-based medicine and patient-centered model. So I have this pictorial thing where it's like where a patient is in a middle and is our center of your universe. And then we have all these satellites around the doctor, the nurse, the behavioral health, and the family friends, and then also the pharmacy lab, and the radiology. So all these multidisciplinary. approach with one single goal of trying to figure out what is in the best interest of the patient and let them actually make the decision. So one of the things you often hear my patients will tell, is that I tell them that this is like you're a driver, I'm your navigator. And you always stay in control which direction we go, how fast we go, whether we go or not. I'm going to always be your advocate. And whether you take a decision that we agree with the decision, or even if you want a second opinion, I will arrange that for you. So by being a huge patient advocate and doing health education, health promotion, that's a big piece of things. My first consultations usually are sometimes 60 minutes or even longer, and explain to them exactly why we're doing what we're doing, what are the risks, benefits, alternatives, and complications, with treatment, without treatment. I think when you are so open, transparent, I mean, they may not be opening up to you on the very first time, but without us building those bridges with the patients, I think it's very, very difficult to achieve that objective. But we have to be always transparent, honest, and be consistent what you're saying. So then they will ask you more questions. And then once you start explaining to them why, and sometimes they'll bring an extra family member, and then you explain to the family members. And then, but I think without the trust, it is very difficult to achieve good healthcare outcomes. Clinical outcomes are very much dependent on not just the prescriptions we write, how much the patient understands and how much they're willing to take those medications or follow those instructions.
Well, as you said at the beginning, just having a really good provider system of care doesn't mean you're actually going to achieve the outcome that we all want, which is healthier patients in the community. Because if they're not accepting of whatever you recommend, if they can't even access the medications, then this is all for nothing, having done all that stuff.
Yeah.
Final question for you, doctor. As you look at all the technologies that are coming down the pipe, whether that's AI or other things, is there a technology that you're very excited about?
So technology-wise, obviously it is where it is going towards. Like, for example, obviously electronic health records, using the optimization of the electronic health records for the best clinical outcome is important. But I think the one thing that I do also, I'm excited at the same time, but I'm also cautious is, would that take away the human element of it?
Okay.
That's a very important thing, right? Because technology can streamline the workload, work processes, but we're still the same human beings, right? And then we still have the same questions, concerns. So when in our excitement, if I may say overexcitement, with the ability to do things much better for the better of the patients. Don't get me wrong, this is always for the best of the patients, but we have to make sure we include the most important stakeholders, that is the patients. That's why I don't usually go and say, this technology is better or this technology is not better. I always go from the patient perspective. If we have the best app and the patient does not even have a smartphone to download the app, that defeats the whole point. And we had this remote monitoring system, and which is very good, and even the new Helio app actually is going to even enhance that. So that if the patient does not have the ability to even remote monitor, so I think the technology, especially I'm talking from federally qualified health center point of view, is that we have to make sure that most important stakeholder, the patient, is also included in the conversation. And we also have to pay attention from not just the organization, healthcare system perspective, but also from the patient perspective. So I think that would be where we can make a true difference. Hopefully, whatever the technology we have, we're able to provide that and extend it to the patients also in a much easier fashion. And then I think whatever the technology helps the patients to be using that technology is, in my opinion, is the best technology.
Well, Doctor, you've shared a ton of great information with us today. Where can people go to find more information about CareSTL Health?
So the best place to go is www.carestlhealth.org, and that is our website, and that is the best place where you can get all the information about our organization, the history of our organization, the services we provide, and where our vision is, where we are looking to go forward in the future.
Doctor, thank you so much for being on our program today. I really enjoyed having you on here.
Thank you, Colin. I really appreciate you inviting me today.
Thank you. This has been Colin Hung with Healthcare IT Today. And if you enjoyed this interview as much as I did, we'd love for you to like and subscribe. Also, head on over to healthcareitttoday.com where you'll find more great content like this. I'm Colin Hung. Thanks for being here, and we'll catch you on the next video.